This medication is used to temporarily treat cough, chest congestion, fever, body aches, and stuffy nose symptoms caused by the common cold, flu, or other breathing illnesses. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up the mucus. Dextromethorphan is a cough suppressant that reduces the urge to cough. Decongestants help to relieve stuffy nose symptoms. This product also contains acetaminophen, APAP, a non-aspirin pain reliever and fever reducer. It's important to note that this medication is not usually used for ongoing coughs from smoking, asthma, other long-term breathing problems, or coughs with a lot of mucus unless directed by your doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Some products are not recommended for use in children younger than 12 years. Be sure to ask your doctor or pharmacist for more details about using this product safely for your child. It's important to follow all dosage directions carefully to decrease the risk for serious side effects. Avoid using this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. Be sure to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking non-pseudo cold relief, it's important to follow the instructions on the product package. Take the medication by mouth with or without food, usually every 4 to 6 hours as needed, or as directed by your doctor. It's recommended to drink plenty of fluids while using this medication, unless otherwise directed by your doctor, as it can help loosen the mucus in your lungs. If you're using the liquid form, be sure to measure your dose carefully using a medication measuring device or spoon. Avoid using a household spoon, as it may not provide the correct dose. Some liquid products may require shaking the bottle well before each dose, so be sure to check the directions on the product package. The dosage of non-pseudo cold relief is based on your age, medical condition, and how you respond to treatment. It's crucial not to increase your dose or take this medication more often than directed without your doctor's approval, as improper use, abuse, can result in serious harm, such as brain damage, seizure, or even death. If your condition lasts for more than 5 to 7 days, gets worse, or is accompanied by a persistent headache, rash, or fever lasting more than 3 days, it's important to consult your doctor. These symptoms could be signs of a serious medical problem and should be checked by a doctor. Some common side effects of this medication may include dizziness, drowsiness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as mental or mood changes, shaking, weakness, problems with urination, or irregular heartbeat. Additionally, seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, swelling, severe dizziness, or difficulty breathing. Keep in mind that this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. Also, if you're in the US, you can report side effects to the FDA at 1-800-FDA-1088, or in Canada, you can report them to Health Canada at 1-866-234-2345. Now let's talk about the uses and important information about non-pseudo cold relief. One of the active ingredients in this medication is acetaminophen. It's important to be cautious with acetaminophen, as taking too much can cause serious liver damage. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. If you have liver problems or if you're giving this medication to a child, you should take less acetaminophen. It's important to ask your doctor or pharmacist about the safe dosage for you or your child. It's also important to check the labels of all your medications to see if they contain acetaminophen, and to avoid taking any other medications that contain acetaminophen without consulting your doctor or pharmacist first. If you accidentally take too much acetaminophen, seek medical help right away, even if you feel fine. Symptoms of an acetaminophen overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing of the eyes or skin, and dark urine. Lastly, it's important to avoid drinking alcohol while taking acetaminophen, as daily alcohol use, especially when combined with acetaminophen, may cause liver damage. Before taking this medication, it's important to let your doctor or pharmacist know if you are allergic to any of its ingredients or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history before using this medication, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, overactive thyroid, or trouble urinating. It's also important to avoid alcohol or marijuana while taking this medication, as they can make you more dizzy or drowsy. If you are using the liquid form of this product, be aware that it may contain sugar, alcohol, or aspartame. This is important to consider if you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet. It's important to inform your doctor or dentist about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of this drug, so it's important to be aware of symptoms such as fast or irregular heartbeat, dizziness, problems urinating, trouble sleeping, or confusion. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, and if you are breastfeeding, it's important to consult your doctor before using this medication. It's important to be aware of potential drug interactions with non-pseudo cold relief. Taking certain MAO inhibitors with this medication can cause a serious and possibly fatal interaction. It's also important to avoid other specific medications during treatment with this cold relief. It's best to consult your doctor about when to start or stop taking this medication. Additionally, some products that may interact with this drug include ketoconazole, levoketoconazole, and rolapitant. It's crucial to carefully check the labels on all your medications to ensure you are not taking more than one product with the same ingredient. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, it's important to inform your doctor or pharmacist. This medication may also interfere with certain urine lab tests, potentially causing false results, so it's important to inform lab personnel and all your doctors if you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms such as passing out or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme fatigue, yellowing of the eyes and skin, dark urine, agitation, confusion, hallucinations, and seizures. It's important to seek medical help if any of these symptoms occur after taking the medication. If your doctor has prescribed non-pseudo cold relief for you, it's important not to share it with others. Make sure to attend all scheduled medical and lab appointments to monitor your progress and any potential side effects. It's important to follow your doctor's instructions and take non-pseudo cold relief as directed. Typically, the recommended dosage is 1 tablet every 4 to 6 hours as needed for relief. Be sure to not exceed the maximum dosage of 6 tablets in 24 hours. It's best to take non-pseudo cold relief with a full glass of water, and it can be taken with or without food. It's important to stay hydrated while taking this medication to help with its effectiveness. Remember, always consult with your doctor or pharmacist if you have any concerns or questions about taking non-pseudo cold relief. If you happen to miss a dose of this medication and you are taking it regularly, take it as soon as you remember. However, if it's close to the time of your next dose, it's best to just skip the missed dose and take your next one at the usual time. It's important not to take a double dose to make up for the missed one. As always, if you have any concerns or questions about your medication regimen, be sure to speak with your healthcare provider. Make sure to store this medication at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any unused medication, make sure not to flush it down the toilet or pour it into a drain unless you're told to do so. When the medication is expired or no longer needed, it's best to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.